Ladies and gentlemen, get ready to meet your new ally in the fight against sleep apnea, the CPAP machine. We're about to watch a video featuring Dr. Vic Veer, a sleep apnea expert, who will give us the lowdown on what a CPAP machine is and share top tips for avoiding those annoying breathing issues, like stuffiness. Here is the amazing Dr. Vic Veer.
Hi there, my name is Vic Veer. I'm the head of the sleep surgery department at the Royal National ENT Hospital in central London. Now, in this video, I want to tell you about how I help people use CPAP for their sleep apnea. Just in case you don't know, CPAP is the mask that goes on your face that pumps air into your lungs, and that blows open the structures in the back of your throat so you don't stop breathing in the middle of the night. Stopping breathing in the middle of the night is called sleep apnea. Now, I think a lot of people know that CPAP is one of the safest ways to deal with your sleep apnea. But again, a lot of people find that CPAP is very difficult to use the whole night for 7.5 hours each night. And that's what we're really aiming for, to use CPAP all the time so that your risk of having complications from sleep apnea, such as heart attacks and strokes and reduced life expectancy, all those things, we can bring those back down to a normal person so you never have to worry about your sleep apnea again. So what I'm going to do in this video is explain what I do to help people with their CPAP devices. Now, I'm a surgeon, I don't deal with the CPAP settings and things like that. And actually, there are loads of videos on YouTube about changing your CPAP settings so that it makes it more comfortable for you. What I want to do in this video is tell you how I help people from a surgical point of view to use CPAP. So one of the first things I do with people who are using CPAP or people who are struggling to use CPAP is to look at their nose. Now, a lot of people don't realize that CPAP causes a blocked nose or a congested nose. And because when the CPAP's off, you can start breathing normally again, people don't realize that this is a problem. So I'll try and explain why this happens. So the basic structure of the nose is there's a little midline partition here called the septum, and then there's the nostrils going in this way as well. But it's not a clear open passage there. There are things inside called turbinates that go in like this. So it looks a little bit like gills if you look at it from the side. When the air passes through, it goes in between these turbinates as it goes through the back of your nose. And the point of these turbinates is to warm up and humidify the air as you breathe it in through your nose. The reason why the turbinates do that is because dry, cold air going into your airway isn't particularly good for you. It causes a lot of crusting in your nose, and also it's not easy for your lungs to extract the oxygen from the air if it's very dry. It has to be humidified, it has to dissolve in the water. Now, the turbinates are excellent at this job. It's very good at warming up and humidifying the air as you breathe it in, but it's not perfect. It's just a biological system. So if you were to squirt air in very, very quickly, it isn't able to keep up with it. Think of it as a radiator. You've got air passing through and you're trying to warm up the air as it passes through. If it's passing through too quickly, it hasn't got time to warm up that air. It hasn't got time to humidify that air, giving it more and more sort of water so it saturates the air as it goes through. So what it does is, rather cleverly, if the air is passing too quickly through your nose, or if it's very, very cold or very, very dry, what the nose does is that the turbinates increase in size to slow down the passage of air as it goes through. So it gives it enough time to do its job properly. Now, you might be able to see in the case of CPAP, what we're doing is forcing air in at rather high pressures, forcing the air through the nose. And obviously the turbinates get a little bit upset. It's trying desperately to try and humidify and warm up this air that is going through into your nose, but it can't do that. So what it does is it swells up, like I said before, and tries to slow down the amount of air going into your throat. Often the CPAP device senses this and goes, oh wow, there's a bit more extra pressure, there must be something in the throat or something like that, and then ramps up the pressure again by the CPAP to try and overcome this blockage that it can now feel coming from the nose. And then they constantly try to compete against each other, and eventually your nose gets completely stuffed up and you can't breathe at all. When that happens, the pressure's so high, you're pushing so much air to try and get past this blockage in your nose that there's a bit of a leak. End up waking yourself up, and that leak goes into your eye and you wake up and you go, oh, you try and rip this thing off because you feel like you're suffocating, which it kind of you are because your nose is completely blocked, and you have a bit of an adrenaline rush because your heart's beating, you don't know what's happened, you can't breathe. After a moment, you feel like you can breathe again, and that's mainly because the adrenaline is surging through your system, and adrenaline opens up your nose so you can breathe again. Depending on what sort of person you are, you either say, oh, I'm not using that, and you go back to sleep without the CPAP on, and you end up just getting sleep apnea again. Or what you do is you persevere and you say, well, I'm going to put it back into my nose or put it over my mouth and try again. But when that happens, the cycle repeats, and then you keep waking up in the middle of the night, and eventually you go to your sleep lab and say, look, it keeps waking me up in the middle of the night. I go to sleep all right, but it wakes me up a few hours later, or even half an hour later. I just can't use it. And a lot of people don't realize it's because their nose gets blocked. So that's why CPAP manufacturers have made humidifiers and warmers on their CPAP, so it's like an add-on that you put onto your CPAP. And the idea behind these is that they already warm up the air as it goes into your nose, so the turbinates don't have to do it. They already saturate the air with water, so the turbinates don't feel like they need to do this for you. And the idea is to get good quality air as far as the turbinates are concerned, good quality air going through the nose, so your turbinates don't go, oh no, this is not good enough, and then starts swelling up and blocking your nose. The problem is that these turbinates are quite fickle creatures, and sometimes it can be too warm or too humidified or too saturated, the air coming in, and then the nose goes, oh, this is not right, and starts swelling up again. So you have to get the humidity and the warming settings just right. Each night I think is slightly different. Some nights are more humid than others, some nights are warmer than others, and so you can set it incorrectly, and to get the right setting is quite hard, and it is difficult, and there are devices out there that have better humidity settings than others, but getting it just right for you, it can be difficult. What we do as surgeons is go, well, let's have a look up your nose. Make sure that your nose isn't twisted, the midline septum area isn't twisted, and that's not causing a problem. We've got adenoids or polyps and things like that. But if it's simply turbinates, we just go, look, why don't you try a nasal spray? And sometimes I tell people, look, use a nasal spray before you even start using CPAP, because it takes a few weeks for nasal sprays to start working. I've got a video in my channel that teaches you how to use nasal sprays properly. There's an awful lot of people just sort of spray and sniff it up, and all the wrong things people do with nasal sprays. Use that nasal spray because sometimes that stops these turbinates from reacting so aggressively, and therefore allows the CPAP to do its job and not sort of start fighting with the turbinates. In some cases, people go, look, I've tried the spray, I can't use it, it's not working. And then we do need to maybe push them out the way or shrink them down a little bit. But hopefully, if you can use a spray and get used to it, keep persevering with the CPAP, it should get to the point where actually I can tolerate this. This is working very well for me.
Although I think CPAP might not be the ultimate answer for sleep apnea, its effectiveness can't be denied. It's a dependable way to manage sleep apnea until you discover a better option or a natural remedy that works for you. For more information on natural solutions, check out sleepwelliq.com.